Okay, good evening, everybody. I'm from Canada, and good morning to Vanessa in Australia. Welcome, everybody. My name is Martin Kelly, and I'm the director here at KOM Consultants. And I think, yeah. Okay. So I'll just start again. Good evening, everybody. My name is Martin Kelly, and I'm the director here at KOM Consultants in Ontario, Canada. And we're joined here with Deakin University and their Faculty of Medicine to learn all about the program, their entry requirements and application dates and everything in between. So KOM Consultants is the Canadian representative. We've been working with Deakin for many years now. I'm not sure how many, but a lot. We've been helping the Canadian students for upwards of 31 years now. So since 1991. We've assisted probably over 14,000 Canadian students overseas. And for students that are looking at Deakin University and their Faculty of Medicine, we would be your point of contact in Canada. So our services to the students are absolutely free of charge. Your applications to Deakin University are absolutely free of charge. And if you're looking at their medical program, this is the time you should start initiating that application with KOM Consultants. To do so, all you have to do is go onto our website, which is komconsultants.com. You'll see an apply tab up in the top left corner. It's easy, just click on the tab, jot in your details, take you 3 or 4 minutes, and then one of our medical admissions team officers will reach out to you and guide you through the process. So if you're ready to apply, just jump on the website and we'll help you through it. Otherwise, you can give our toll-free number a call, 1-877-318-8203, or you can give us an email at info@komconsultants.com. So at this point, just for the students that are looking to apply, as I said, applications are open. We'll need a few documents from you. We'll need your MCAT results. And I believe Vanessa or Tori can confirm exactly how long those MCATs will be valid for. I think it's 2 years, don't quote me. We'll need a copy of your transcripts, and we'll also need a copy of your passport. So there's not many things that you have to send in to us at this point to get yourself going. But I think I'll leave it at that, and I'm going to introduce Tori and Vanessa from Deakin University. I believe, Tori, you're tuning in from the States, and Vanessa, thank you for tuning in from Australia. So I will hand it over to you ladies, and we look forward to this evening's session.
Thanks, Martin. And it's really nice to be back with you and Sue and the Canadian crew. So Tori and I will briefly introduce ourselves so that you know who we are. And then I'll run through a little bit about our program. And then depending on how many questions we get from the audience, Tori also has a whole lot of questions that she's usually happy to ask me and put me on the spot. So I'm Dr. Vanessa Vaughan. I'm an academic with the School of Medicine at Deakin University. So our campus is based about an hour outside of Melbourne in the southern part of Australia, so a really beautiful coastal campus. My role at Deakin is, well, I'm a lecturer in public health medicine for the medical program. So if you come to Deakin, you'll see a lot of me, particularly in your first year, as I teach you all about the things that are the causes of ill health. I'm an active researcher, so I work with our local healthcare provider, looking at multidisciplinary teams for cancer care and how we can best support patients and their families through those services. And I'm also our international recruitment coordinator for the medical program. So a lot of my time when I'm not teaching and researching is jumping on webinars like this one, answering all of the questions for students, helping them through the interview process, and then eventually having the joy of welcoming them to Deakin when they start. And I've been at Deakin since 2006 as both a staff member and a student. So I know most things and can answer most questions or point people in the right direction. So that's a little bit about me. Tori, do you want to briefly introduce yourself as well?
Yeah, sure. Hi, everyone. My name is Tori Ellenberger, and I am actually based in North Carolina in the US. So I represent Deakin here on the ground and sort of serve as a touch point for students or parents or anyone who has questions along the way, and serve as sort of an intermediary between our colleagues at KOM and Vanessa, myself, the admissions team. So if you have any questions about the process or student life or anything like that, please feel free to reach out to me directly.
So I know that Martin was saying that now is definitely the time to be putting together those applications. So I will very quickly run through what the requirements for those are, and we'll get the slightly boring logistical stuff out the way first. So you do require an undergraduate degree to be completed or to be nearing completion. So that's a 3 or more year bachelor level degree we say it's a GPA of a 5.0 out of 7. So in Australia, we have a pretty standardized GPA system. Most of the universities use the same system. So I know it does vary between schools in North America. So I've seen some pretty interesting ones come out of Canada and the US. So if you do have any questions about making those conversions from your GPA to an Australian GPA scale, definitely let the team at KOM know, and they can help you out with figuring out if you've met that 5.0 out of 7. It can be from any discipline, so it doesn't have to be a biomed, it doesn't have to be a clinical degree. We don't have any prerequisite subjects. So if you are keen and you have an education background, or you are an engineer or anything like that, we also will welcome your application. We actually think that's really important to make sure that we have people in our cohort that are from really diverse backgrounds. So yeah, as long as you are meeting that GPA, it can be from any discipline. At the moment, we don't take into account master's level or postgraduate degrees for their GPA, though if you did complete your undergraduate degree more than 10 years ago, we use that to make sure that you are still studying at an appropriate level to enter into the degree. So if you do have subsequent degrees after your most recent bachelor, send those transcripts along as well, because they'll be useful. That's not to say that it won't come in handy, because definitely we love to talk about further training and further experience in the interview process. The other thing that you need before getting to interview though is an MCAT, or we also accept the GAMSAT, which is sort of the one that we use in Australia. So you need a MCAT of a minimum 125 in each section, which is a 500 overall. And you do need your MCAT completed before we can offer an interview. But if you do have questions around the timing for that, I'm sure that the team at KOM can help you out with when the best sitting date for you would be. So those two together make up 25% each of your final ranking score. The majority of your ranking score is the interview, worth 50%. So basically you sit down with an academic, and usually a clinician or a community member, and it's a interview just with you for around 50 minutes. And in that interview, we spend a bit of time getting to know about you. So who you are, what your background is, what you like to do when you're not thinking about getting into medicine. And then we have 5 questions that we work through, sort of like a multiple mini interview, that you're given a question, you have the opportunity to respond to it, and then we have a little bit of a back and forth, asking some follow-up questions. Unlike a more traditional medical school multiple mini interview, it's a bit less formal, it's a bit more of a conversation, because we know that this is a really important decision for you, and interviews are often the only time that you have the opportunity to sit down and speak one-on-one with someone from the school. So it's a great opportunity not only for us to get to know if you're the person for our medical program, but to make sure that we're the right medical program for you as well, because we do know that it's a big time investment, it's a big financial investment, and it's a big social investment, moving halfway around the country, often away from family to somewhere you might never have been before. So we want to make sure that you're really comfortable with that decision before you're made an offer. So those are the 3 parts of our application process. In terms of the closing dates for those, we're actually keeping our applications open until we're full this year, but we do have interview rounds. So the first of those interview rounds is, I'm just checking, we've got the first week of April. So that one's coming up soon. We have 1 week of interviews in July, and then if we still have some places left, we'll have some more interviews in mid-October. So those are the 3 rounds of interviews that we'll be having this year. We usually say to have those, have your application in around a month before those interview dates, and I will send those through to the KOM team to make sure that they have those. That just allows time to make sure that your application works through the system and that we can get an interview offer out to you. Don't worry too much if you are within that 1 month, because if we have room, we'll definitely be still inviting people to interviews for that session, or you may be invited to the session afterwards. So that's pretty much the process. Tori, do you think I've missed anything, or any questions from anyone about the process itself?
I don't think you've missed anything.
So maybe, yes. So just for the students that are logged on right now, thank you for your time, but certainly feel free to type in the chat box, or if you want to, if you're comfortable enough, unmute your microphone. Ask us a question. It could be about the program. It could be about entry requirements. It could be about Deakin University and what the university is like. So this session is here to help you through everything. But maybe Vanessa, you could talk about how many seats might be available to international students.
Of course. So each year we have 15, so 15. To 20 places available for international students. That's out of a cohort of 150 total. So it is only a small number, but it is a small cohort, and we get to know everyone really well. Because it's only small numbers, it can get quite competitive. So if you're not successful the first time, we say, please take that as a learning experience and come back stronger the following year. It's not uncommon for students to apply 2 or 3 times before they get into the medical school. And every time people's applications and their interviews just get stronger and stronger. So it can be quite competitive, but we really like having a small cohort for a few reasons. One, as I said, we get to know everyone. I'm not Dr. or Prof. Vaughan, I'm Vanessa, or hey you with the face. Everyone, I am back on campus, not today, but most days I'm back on campus, and walking down the corridor, it's really great to be able to stop and have a chat to our students. And we recently just had all of our international students, many of which are Canadian. I think about 3/4 for this year's cohort are Canadian. And it was great to be able to, stop in the corridor the last couple of teaching days and say hi and see how they're settling in. So that's one reason that we love having such a small cohort. It does mean more one-on-one time with your instructors. So we do a lot of small group learning in terms of sort of teams. We use the problem-based learning model that I know is very popular at a lot of Canadian universities as well. And a lot of small tutorials that you'll have maybe 15 to 20 people in a room, rather than the whole cohort. About the only time we see the whole cohort together is for lectures. So it's really great from that perspective as well. And it's not within the cohort, it's a very sort of really supportive environment as well. It's not super competitive. Everyone is really collegial, really helps each other out, as opposed to, I guess, the somewhat unpleasant environment that medical school can be painted as. So it's nice to not have that very nasty competitiveness within our cohort. And the other important reason is to make sure that when you get to the end of your degree, you have the best possible chance of having an internship. So once you complete medical school in Australia, you have to do a 1-year internship, so a paid position, but it's still like introducing you to the system. And as international students, unfortunately, you aren't guaranteed a place in that, but it is based on your performance within medical school. So if we have a small cohort, first, we can make sure that the people coming in have got the skills that we really want to see. So, you know, we can teach you all the doctoring things, we can teach you surgery, we can teach you anatomy, we can teach you pathology. We can't teach you to be a good person. So we can't teach you empathy. We can't teach you how to, you know, have passion about the local football team. That's just, you know, that's religion. That's, you know, it's that comes with you. So really, we're making sure that the people that are most likely to succeed are coming into the program, so that you're most likely to get that position when you graduate. And really excitingly, so we've graduated our 1000th doctor recently, and we have never had someone miss a place. So we have 100% employment out of our program, which is one of the reasons that we really favour that interview part of the process and have that small cohort, so we can make sure that you're supported the whole way through.
That's fantastic, Vanessa. It actually sounds like a beautiful place to be doing your studies, and a fantastic environment, not supportive environment. Perhaps one of the questions, or two of the questions we really get are, what is and I know you stated that the grade point average in your MCAT make up about 50% of it, 25% each, and then the interviews a big chunk of how the assessments are actually completed. But do you have any indication what a competitive GPA and what a competitive MCAT score would be?
It can be really tricky just because of that weighting. So we've had people regularly that might score very low on, say, an MCAT. They meet the minimum, but they're at that 500. But they've had an excellent GPA and a really excellent interview. So we usually say, even if you are sort of on the lower end of those minimums, still pop an application in, because if you're strong in the interview, it can really help with outweighing that. We don't normally release competitive just because of that variation, and we don't want to discourage people. I'm just having a quick look at some of our information from last year. Now, last year and the year before weren't hugely representative, which is the other thing, because we had universities that weren't giving grades. We had a lot of difficulty with people getting into MCATs. So last year we did offer, the lowest MCAT that we offered to was a 502. So on the lower end of that scale. And the lowest GPA that we offered to was a 2.7 out of 4. So, which, doing some quick math, is also, it's a little bit higher, a tiny bit higher than what the minimum is, but still on the lower end. So those are the lowest that we offered to, and then they sort of went the full way up as well. So like I said, that was an interesting year, but I would expect to see that every year. So definitely we recommend it, that if you're have those minimums, to pop in an application and have a chat to us.
Yeah, and I'm a big advocate of the way Deakin assess applications, because not all universities do an interview. And it doesn't allow the students or the applicants to actually show the faculty who they are and why they want to go into medicine. So it's nice, it's a breath of fresh air to see that a faculty takes that into consideration, because there's a lot more that goes on with into a school of medicine and eventually caring for patients than just what you can achieve in transcripts and MCAT scores. So good on Deakin for doing that, and allowing students that may have a lower grade point average or a lower MCAT score that opportunity to pursue the passion that they want, which is medicine. So yeah.
Definitely all really important for us. So we have a bit of a saying that good students don't necessarily make good doctors. So yes, being able to score well on an exam is important, but I also want to know that you can take a patient history effectively. So
yeah. As a patient walking into an office, I want a little empathy shown to me, so that's good. So if there's any questions from the students, certainly unmute your microphone if you're comfortable. If not, drop it in the chat box there, and we can help you out with that.
I see a familiar name from in Ian in the chat, and Ian just had a question about attrition rate. We have a very low attrition rate, so it's usually across the full course we might lose 1 to 2 students from a cohort across the 4 years. We have a lot of support systems in place to help students that do feel like they need to take some time out, and often students might decide to take a year off of study. So that might be that they have some issues outside of the classroom. So family, they might have caring responsibilities, they might have financial troubles. So wanting to take a year out of the program to, I guess, spend some time on those things, which is something that we definitely support. We have a psychologist that's specific to our school, who's available to all of our students. So if people feel like they're getting burnout, if they're getting anxiety, if they're having trouble coping, then Jacqueline, our psychologist, is available to help as well. We have regular check-ins with all of our students. So within our, I have 18 students that I specifically support, and then all students have one staff member that they can go to each semester with any issues, and we check in with them really regularly. So I actually last week just had meetings with all 18 of those students, and that helps us to make sure that you're tracking academically, that you're looking after your work-life balance and yourself outside of medicine. And then we also have academic support programs as well for people that do have some issues with the content. So whether that's teaming you up with one of your peers, whether that's getting you in touch with, say, writing services that the university has, or you know, we provide really detailed feedback on assessment as well. So all of those things, I think, come together to, I guess, have that low attrition rate that we do have. Obviously, along the way, we do end up still having 1 or 2 people that, you know, they decide medicine's not for them, or they have other reasons for withdrawing. We completely understand that. We do what we can, but sometimes, yeah, we just have to love people and let them go. But we are pretty proud of the way that we're able to support students through the program.
That's fantastic. One of the questions we get are from some high school applicants that are looking for pathways into your grad entry medical program. So does Deakin offer opportunities for high school students to do an undergraduate degree at Deakin and then into your grad entry program?
So we don't have much in the way of specific pathways, just because we do have that very open policy of being from any academic background. So what we normally suggest is saying, you know, do an undergraduate that you're passionate about. Like, we know that med is the end game, but if you're really passionate about a particular area of health, so say you do want to get those clinical skills early, you could look at nursing. If you're really keen on public health and how we stop people from getting sick in the first place, then you could go do a public health degree. If you're really keen about also looking at, you know, helping people to learn, whether that's, you know, as a doctor, or, you know, helping people with other elements of their health literacy, you could look at an education degree. So we really say, do whatever is making you excited. If that is biomed, that is also okay. I come from a biomed background. It's the most common for our students to actually come through with. But we also do see a lot from other areas as well. So yeah, it's 3 years of your life or 4 years of your life. So make sure you're enjoying it along the way, is mine and the school's position, really.
Great advice, great advice. Tori, I don't know, I can keep asking questions to help the students along, or if you have any input you want to jump in with.
Sure. One question that we get a lot is, Are there any like clubs or societies that are specific to medicine students that you could tell us a bit about?
Oh my gosh, so many. We have an incredibly active student body, and because we have that big focus, I think, on work-life balance, it means that we've just had all of these different extracurriculars pop up. So the main overarching one is Medusa, which is our medical student society, and they are, they're our course representatives. So they're class reps, talk to the staff on a regular basis and let us know what's going on. They run skills workshops, academic workshops. They help you prep for all of your assessment with running different, their OSCEs, so your situated exam, what would you call it, simulations that they run, big social events. So we just had Med Camp a couple of weeks ago, where all of the students from different year levels head off to basically a scout camp and have a great weekend doing a heap of stuff. So that's sort of the overarching one, Medusa. But then there's also a whole range of others. So I'm really involved with helping a group called Skillet Kitchen. So basically, that's a group of students that are really passionate about helping people develop their nutrition literacy. So they get together, they teach you how to cook a meal, they have a chat about interesting things to do with food and nutrition, and you get a nice cheap meal out of it at the end of it, which is really, really fun and really awesome. We've got MedFit, which is a group of students that get together a couple of times a week and run through different physical activities. So one day they're playing basketball, the next they're going for a run, they do lots of different stuff. We've got different interest groups for different medical disciplines. So the obstetrics gynecology interest group, surgical interest group. We've got rural societies. Deakin's got a really big rural health focus. So there's a couple of societies that are very focused on making sure that students that do want to go rural are appropriately prepared. There's a couple of just fun societies that are there just to have good times. And yeah, so there's a really huge mix. There's something for everyone. And as a conversation I just had yesterday with one of our students, if there isn't one for your particular interest group, you can always start it. Which is how we've ended up with so many. And it's not uncommon for people to be involved in sort of 2 or 3 along the way.
That's great, Vanessa. And I am aware of the time. So if you do have questions, quickly jot them in, because Vanessa and everybody, we may have other commitments. So I just want to make sure we get up to all your questions. But Vanessa, you touched on the support and the counseling support that your university offers, which is great. And that brings up the question, what would the typical day look like for a med student in year 1, year 2, year 3, and 4? Like, are they in school 12 months out of the year at the beginning, or is that later in the degree? So maybe you can touch on a scheduling.
Yeah, so years 1 and 2, we've got 2 18-week semesters. So it's a long year, but we start sort of our academic year runs the last week of January through till June. You've got exams, you have a short break mid-year, and then you go the end of June through till November with your final exams in the 2nd or 3rd week of November. So it can be a long year, I won't lie, but we do try to break it up into blocks so that it's a little more, I guess, there's a bit of structure around it. So the first 2 years, you're based on our Warm Ponds campus. So we call it preclinical. And really that's developing your foundation knowledge before you go into the clinical environment full-time in years 3 and 4. So a typical week, on a Monday and a Friday, you'll have problem-based learning. You'll be introduced to a case, a person, and work through that. And on the Monday, you develop a whole lot of questions about the things that you don't know about this particular case, about this patient, about their history, about the pathology that they're coming in with. Then during the week, you'll have some lectures. You'll have one day that has a pathology and anatomy workshop, so getting down into the labs and working with our anatomy pathology museum, and doing some dissection work as well. One day is dedicated to clinical skills, so you might have maybe a lecture or a couple of lectures in the morning on a particular clinical skill, and then have your practical class during the day. Normally for year one, Thursdays are kept relatively free. So that's sort of a bit of a free study day, but once a month you'll also have a placement, which is usually a community-based placement. So you might go to a GP, you might go to a general practitioner or a family practice. You might go to, say, paramedicine and go out on some call outs with them for the day. You might go see a diabetes educator and sit in with their patients as well. So that's one day a month you'll have an opportunity to do something like that. And then Fridays, you'll have some more lectures and the last of that PBL. And usually all my lectures are on Fridays, so it's sort of public health and ethics Fridays, which is sort of usually a fun way to end the week. But so that's sort of a week. You get a lot of time between lectures. We try to tell people that it works really well if you study sort of 9 to 5, treat it as a job. And if you do that, you generally have a lot of free time to do other things. But some students will always study more than others. But yeah, we do try to make sure that you do have those free study days. We're mindful of assessment, so we try not to make sure that everyone's assessments are due on the same day, so you're not frantically working on 5 assessments at the same time. Those are spaced out across semester. So that's sort of year 1 and 2. And then in year 3 and 4, you're actually based fully in one of our clinical schools. So our clinical schools are co-located with usually hospitals, but we also have a rural clinical school, which is actually based at a whole lot of family practices across rural Victoria. And as across those 2 years, you'll rotate through different areas of medicine. So that might be general medicine or surgery or palliative care or mental health across those 2 years. During those 2 years, we also have opportunity for placements in the Northern Territory. So our First Nations focused rotations in the Northern Territory up in the top end. So Indigenous health and First Nations health is one of the really key pillars of our program. So we do want to make sure that people have that opportunity for full immersion in those particular rotations. And then unfortunately paused due to COVID, but by the time anyone here gets to year 4, we also have the opportunity for international placements in 4th year. So basically you have an elective block, which is 6 to 8 weeks, and you can go anywhere in the world within reason to have a look at any type of medicine you like. So that's really exciting. We've had some people go to places like Greenland. We've had some really interesting experience. We've got a partnership with Copenhagen, so a lot of students go there. But it's also a great opportunity for if you're planning on heading home after you finish medicine, to get a feel for what the Canadian system looks like as a doctor. So our students that plan on heading home, wherever home is for them, will often try to make sure that that international rotation is in an area that they're interested in working, so they can get to know the people and make sure that, I guess, the expectation matches the reality as well. What else is in year 3 and 4? And the research scholar program is in years 3 and 4. So I know a lot of medical students are really keen to do research. It sort of goes with the territory, I think. So basically in years 3 and 4, everyone has the opportunity to work with a research supervisor or an advisor. And over that 2-year period, you develop a research project. Some people get to actually complete their research project, some not, just because of the scale of time and trying to fit it in, but everyone walks away with something that they can be proud of, that is potentially able to be implemented down the track. So we actually pretty regularly do end up applying for funding to complete people's projects, but then also you walk away with something publishable at the end of it, which is important for when you're applying for those the word is slipping my mind, residency positions and training programs down the track. So yeah, that's years 3 and 4.
Yeah, that's great. Have you had, do you know of any Canadian students that have come back to Canada for their international clinical placements at this point?
I can think of a few that did in sort of a few years back now. No one that's done it in the last couple of, like we've unfortunately had it paused for a few years just because of COVID. But I do know a couple that have gone back and done a placement in Canada. So I think one went to Alberta. I think they were in Edmonton from memory. And then I think we also had someone head to Calgary a couple of years back as well.
Well, that's great. And the other opportunities.
There's probably others as well that I've just forgotten about.
Yeah, and even the opportunity to go to Copenhagen or Greenland, amazing. Yeah. Amazing. I think we'll just give it 1 or 2 more minutes, ladies, if you want to. So if there's anybody that has any questions, just drop them in the chat box or unmute your microphone.
I guess the other question we get a lot about is, what is Geelong actually like, considering you're sort of here for at least 2 years? And I guess one of the things that we joke a little bit that Deakin's medicine's a little bit of a lifestyle choice, because I think half of our students disappear after class and go surfing, or they're rocking up from having surfed into class. So our campus is about 20 minutes from the beach. And a lot of our students end up living down near the beach in Torquay, which is sort of the coastal town where our big surfing comp is held every Easter. So it's a pretty relaxed city. It is a city, but it has a bit of a big country town feel in that you get to know everyone. It's being only an hour from Melbourne means that you can sort of head up the road for all of the really exciting stuff like festivals and theatre, if you're into theatre, and restaurants and amazing nightlife in Melbourne. But Geelong has some really cool, quirky cafes. It's a little bit similar to Hamilton in that it is quite, it has quite an industrial history. It's seeing a bit of a transition into more of a knowledge generating economy now. So the university here, a lot of the big national government bodies are starting to have their offices here as well. So we're starting to see a little bit of a shift away from industrial towards that more white collar, but really great town, lots of great coffee, pretty relaxed environment, and lots of good spots to live. If you like hiking, there's hiking just down like half an hour or an hour away, depending on how extreme you want to go. Lots to do. So it's a great place to live, and one of the reasons I decided to stay. And then the campus is fantastic as well. So if you jump on our website, there's heaps of photos and videos of our campus, which is just beautiful. So the one drawback of me not having a slide deck is not being able to pop them up and show everyone all the great photos.
What is it? A picture's a million words or 1,000 words? Or,
that's it.
Okay, well, I think what we'll do is we'll wrap it up at that. There doesn't seem to be any more questions coming in. So I'd like to thank all the students for tuning in this evening. And if you need some more information on Deakin University or the Faculty of Medicine, or you want to start an application or get some updates on your application, certainly contact KOM Consultants. Toll-free number again is 1-877-318-8203. Or you can give us a quick little email at info@komconsultants.com. But Tori, thank you very much for your time. And Vanessa, Thank you once again for all your support and all your time. Okay.
Absolute pleasure.
So well, I'm just going to stop the recording, and everybody in North America, have a good evening. And Vanessa, you have a great day and good morning once again. Okay.
Thanks very much.
Thank you.
Okay. Bye-bye.
Bye.